Good afternoon. I'm Major Jim Vredis of the Texas State Guard. I'm currently assigned to the position of Staff Surgeon for the Army Component Command of the Texas State Guard. Today I'm going to go over the correct use of the Texas State Guard Tcc or Tactical Combat Casualty Care Card. A quick note about the cards. Even though the cards were originally designed to document treatment given to battlefield casualties, they can be used for all trauma patients. Data gathered from Tcc card serves as the basis for many of the recent changes to clinical practice guidelines in both battlefield medicine and civilian trauma care. This is what side 1 of the card looks like. And of course, this is what side 2 looks like. The cards have a hole punched at the top. The cards are to be secured to casualties and left attached to the casualty until he reaches the final medical treatment facility. In our case, this will usually be an emergency department or trauma center. The cards can be secured using boot laces, dog tag chains, or by rubber bands looped through the holes and placed around the casualty's wrist. Each soldier, and in this case I mean soldier, airman, or TMAR personnel, will keep 2 copies of the card in his or her left breast pocket. The first card should be filled out with that soldier's personal information. This card will be used to document care given to that soldier in case of injury. The second card should be left blank. It can be used to document care rendered to someone else. The cards have a coated finish and are resistant to water, blood, vomit, and other bodily fluids. They can be filled out using any pen or pencil, but I have found that fine-tip Sharpie works the best. Sharpies also can be used to document directly on a patient's skin. NATO, the United States military, and the Texas State Guard recognize 5 evacuation categories: urgent, urgent surgical, priority, routine, and convenience. Since many Texas State Guard personnel are not familiar with these, I will go over each briefly. EVAC urgent. Evacuation of these casualties should be as fast as possible and not later than 2 hours from the time of injury to save life, limb, or eyesight. EVAC urgent casualties have injuries that cannot be controlled in the field, but have a good chance of survival if evac'd appropriately. Examples of EVAC urgent casualties are those with cardiorespiratory distress and those casualties in shock not responding to IV therapy. EVAC urgent casualties may have had prolonged unconsciousness, head injuries with signs of increasing intracranial pressure, or burns covering 20 to 85% of the casualty's total body surface area. Stateside, EVAC urgent surgical cases must be transported to trauma centers for rapid surgical intervention to save life, limb, or vision. Examples of EVAC urgent surgical casualties include those casualties with decreased or absent circulation in their extremities, those with open chest and or abdominal wounds with decreased blood pressure, and those with severe penetrating injuries. Uncontrollable bleeding or open fractures with severe bleeding, facial injuries, and those burn casualties with burns to the face, hands, genitalia, or perineum, even less than 20% of the total body surface area. Although recovery from most spinal cord injuries is poor, injuries to the bony spine, such as fractures and some dislocations, can be surgically stabilized to minimize or prevent spinal cord injury. EVAC priority casualties are those casualties who must be evacuated to definitive care within 4 hours from the time of injury. These include those casualties whose clinical condition has a high probability of worsening and becoming EVAC urgent or EVAC urgent surgical. Examples include close chest injuries, casualties who had brief periods of unconsciousness, soft tissue injuries, close fractures that have no evidence of vascular insufficiency, such as loss of pulses or pallor distal to the fracture, and open fractures without uncontrollable bleeding. Abdominal injuries without hypotension are also classified EVAC priority, as are simple eye injuries. EVAC routine casualties should be transported within 24 hours of injury. These include simple fractures, open wounds, including open chest wounds without respiratory distress, psychiatric cases, and terminal cases. Stateside, we would almost always transport terminal cases urgently. But during a disaster, when resources are overtaxed, Terminal cases should only be evac'd after all potentially survivable casualties have been evacuated. EVAC convenience casualties are those who are transported by medical vehicles only as a convenience rather than as medical necessity. These include open wounds, brain strains, and minor burns under 20% total body surface area. We're finally finished reviewing the EVAC categories and can get back to the rest of the card. I promise the next sections will progress much faster. Mechanism of injury. Place an X in all appropriate boxes to identify the mechanisms of injury. Tourniquet use. If tourniquets are used to control hemorrhage, indicate the type of tourniquet used. Tccc approved tourniquets include the CAT Combat Application Tourniquet, which is the most commonly used brand, as well as the soft, matte, and SWAT tourniquets. Be sure to note the time the tourniquet was applied. Place an X at the injury sites. If there is more than one type of injury, you may label them. Burns should have their outer margins marked. At the bottom of side 1 is a chart for documenting vital signs, oxygen saturation, alertness, and pain scale. AVPU refers to a casualty's responsiveness. A is equal to alert. The patient's eyes are open without any stimuli. V equals voice. The patient opens his eyes or responds to voice. P equals pain. The patient opens his eyes or responds to a painful stimuli. U is equal to unresponsive. The patient is completely unresponsive to all stimuli. Indicate AVPU with a single letter that corresponds to the highest level of alertness. Pain scale information is obtained by asking the casualty to rate his pain if he is alert and can speak or indicate a response. Facial indicators can be used if the patient is unable to indicate his pain scale. At the top of side 2, we document the treatments given to the casualty. Indicate with an X in the appropriate box if you apply an extremity tourniquet, a junctional tourniquet, a pressure dressing, or use a hemostatic dressing. Please note the type of hemostatic dressing or junctional tourniquet used. Document airway adjuncts used, if any. These include the NPA or nasopharyngeal airway, a cric or cricothyroidotomy, an endotracheal tube, or a supraglottic airway such as an LMA or King. Again, document the brands used whenever possible. Continued documentation of treatment including oxygen, needle decompression of a chest tube insertion, and or the use of a chest seal. On the middle of side 2, you document any IV fluids and or blood products given. Be sure to document the type of fluid or blood product given, the volume, the route either intravenous or interosseous, and the start time of fluid administration. Document the names, dosage routes, and times for any and all medications administered. Use an X to document if a combat, pill pack, or over-the-counter medications are used. Also note if a metal eye shield or splint is applied. Document any hypothermia protection devices used as well. There's a small space at the bottom of the second page for any additional notes you want to add. The person providing care should print his last and first names along with the last 4 of his Social Security number at the bottom of the card. I realize that many of you who just finished this presentation are saying to themselves, I have no idea what a lot of that stuff is. This is our fault and we plan on fixing it. We have been remiss in training our troops for many of our real-world missions. Over the next couple of years, we'll be offering medical training to all Texas State Guard forces. Please, always carry your card with you and keep it up to date. Your card will be used to document your care if you are injured. The information on that card could help us save your life. Please contact me if you have any questions or comments at the email address above. Thank you for your time and have a great day.